Hello and welcome to the Clinical Liver Disease video series. CLD is an official digital learning publication of the ASLD. I am Juan Pablo Arab, Associate Professor of the Western University in London, Ontario, Canada, as well as the Chair for the Alcohol-Associated Liver Disease Special Interest Group at the ASLD. I'm here with Dr. Hailemichael Desalegn and Dr. Luis Antonio Diaz, authors of the article entitled Impact of Alcohol Use in Liver Disease Outcomes, recently published on CLD. Welcome, Dr. Diaz and Dr. Desalegn. I will start with a question for Dr. Desalegn. So, according to your article, what is the relation between alcohol consumption and other liver disease?
Thanks so much, Juan Pablo. So usually we have said that individuals who consume excess alcohol and presenting with liver disease, it was clear to say that these patients are having alcohol-associated liver disease. In this study, we tried to look at the other factors, the other etiologies of liver disease, and that could be impacted by alcohol use. Concerning the viral hepatitis, alcohol has an effect on the different stages of the progression of the hepatitis virus, hepatitis B and hepatitis C virus infection. Alcohol has been shown with an increased transmission of the virus. It's also important in the chronification of hepatitis virus infection. The proposed mechanism that we have found includes the suppression of the various components of the immune system. In addition to that, it's also associated with dysregulated inflammatory response. And we know that an increased oxidative stress plays a role in the chronification of the virus, and alcohol has been associated with increased oxidative stress. Here, I would like to say that with these factors, it also affects control over the viral replication. So this means individuals with hepatitis B infection and alcohol has been shown to have an increased hepatitis B viral loads that had been also observed in studies and observational studies, and also animal studies have shown this, and also hepatitis C virus infection. And patients with alcohol-associated liver disease were also having a higher viral load. So it increased the viral, it's associated with loss of the viral control, causing an increased replication. And in addition to that, it increased the chronification of the virus. We know that hepatitis B is not directly cytopathic, but affecting the immune response and dysregulating inflammatory response. In adults, the control will be lost, leading to an increased cirrhosis, and that could progress to HCC, the cancer, and also the need for liver transplantation. So with this, I would like to say it affects the every stage from the transmission, the chronification, and also to the poor outcome of the virus infection.
Thank you very much, Dr. Desalegn. Very interesting. And now for Dr. Diaz, a hot topic question. So what is the specific relation between metabolic dysfunction and alcohol consumption?
Well, alcohol can interact with other relevant risk factors for liver disease, including obesity and diabetes, promoting a higher risk of chronic liver disease and accelerating progression of liver fibrosis, especially in susceptible individuals, for example, those with high-risk polymorphisms. And this relationship was acknowledged by the 2023 Cirrhotic liver disease nomenclature, including levels of alcohol use in the diagnosis of metabolic dysfunction associated with cirrhotic liver disease, alcohol-associated liver disease, and the intersection between these two entities called MET-LD. Therefore, alcohol should be assessed in all individuals with suspected liver disease. And this assessment can be easily done using questionnaires like audit or other simple questionnaires. And we can also use some biomarkers, including indirect and direct biomarkers for alcohol use.
Thank you very much, Dr. Diaz. That was extremely interesting. And thank you again for joining us for another installment of the Clinical Liver Disease video series. Thank you everyone for joining us. On behalf of all of us on the CLD team, I hope you have found this video on impact of alcohol use on liver disease outcomes useful. For more information about alcohol-associated liver disease, please visit us on www.cldlearning.com, and thanks again for watching.